In a perfect world, there would be enough physicians for every patient and enough time to offer more personalized care. Guardian MD moves your practice in that direction.
Concierge medicine to me is really a way to try to bring practice back to where it used to be. Like when I started 20 years ago, it was more me, one patient, one nurse, to have more of a smaller, intimate setting, allow you to spend time with patients. And today's sort of corporate way medicine works really sort of doesn't allow that. It detracts from the doctor-patient interaction.
Thanks to locally owned Guardian MD, today Dr. Carl Page is back to practicing a more personal care approach. Dr. Page has chosen to take advantage of Guardian MD's hybrid structure of services, and in his practice continues to see his existing patients as well as those who have signed on to the concierge program.
Well, we block time for those patients. So, part of my day will have no schedule, no patients booked into that time except for Guardian patients. There may be some times where there's no one in that slot, and that gives me time to, answer emails or call the patients back on test results or call another physician directly about the patient and spend time doing that, which the traditional schedule really leaves no time for that. And then, if a Guardian patient would need to be seen, we would book them for that time.
I think prior to Guardian, it was the frustration of calling and needing an appointment. Say you're sick and you want to get in this week, and you call and they say, well, we don't have an availability for 3 weeks out. Well, by then I might feel better and I may not even need the appointment. So at the Guardian program, I've seen a big change in that you can get right in when you need to.
Guardian MD is accessible to a large number of Dr. Page's patients because of its unique tiered fee approach. Not only does this allow a patient to sign up for the affordable concierge services they can afford, but they can also have more control over the type of health care they receive.
The chronic problems that people deal with in healthcare today, diabetes, high blood pressure, high cholesterol, heart attacks, strokes, they're problems that started 20 years before they came to a crisis. And if they would have had an intervention or some interaction with the healthcare provider that could have pointed in the right direction at an earlier time, maybe they wouldn't develop that problem. And that's really, what I'm shifting to in medicine is more dealing with a problem well in advance to try to prevent it or try to augment a person who's healthy and push them to a higher level of health.
Besides extended and quality time with his concierge patients, Guardian MD's program also benefits Dr. Page by allowing a limited number of patients, more time to research and follow up, better communication between patient and physician and between the primary care physician and specialists, plus a better work-life balance. Dr. Page also enjoys the ease of working with a company based in his hometown.
I wanted to try to maintain as much local flavor and also have as much direct input with the management and people in control of decisions how the program is run. So I guess maybe it's partly because I'm a doctor. I like to be in control of things, but I wanted to have it more on a local level.
With a retention rate of above 90% for those patients who do enter concierge medicine, Dr. Page has found a winning combination in Guardian MD's unique concierge medical program.
I think it does help improve my health because we're working not only to resolve the health issues that you have right now that you see in your test, but we're working together to work on a prevention program for the future.